After studying this module, you shall be able to know about the commonly used drugs in sports, classification and nature of the drugs used in sports, and the techniques for detection of these drugs. Now we will start with the introduction. Drug abuse in sports is habitually called as doping. The universal word dope is being used both as a noun and a verb. The word does not appear in this context before the 20th century, regardless of the practice of horse nobbling, which was known well before this time. For example, the story of the famous trial of Daniel Dawson, publicly executed at Cambridge in the year 1812 for poisoning racehorses with arsenic. The abuse of drugs is an attempt to enhance the performance in human sporting competitions is not new. For example, the Greek authors Philostratos and Galen stated on the ethics of participants in the Olympics who would take any preparation to improve their performance. Roman gladiators were often intoxicated to make their fights more vigorous and gruesome as demanded by the spectators. The effect of drugs on performance is often exceptionally difficult to determine, and there is little conclusive available work for any species. The results that have been published are often contradictory, as some of the workers advocate an increase in the competitors' performance and others suggest no improvement. The assessment systems used to evaluate the effect of drugs may not sufficiently relate to the appropriate sporting performance, such as the increase in muscle strength and the sprint running. Moreover, athletes may take far larger amounts of drugs than would be ethically acceptable in most human experiments. The toxic side effects of drugs are less difficult to ascertain, but the conclusions drawn from the available data are often contingent. However, there is sufficient evidence of the harmful effects when certain drugs are misused to validate their prohibition from sports competitions. In human sports, the main monitoring body is International Olympic Committee, or the IOC. Nevertheless, since 1999, doping concerns have been taken over by the World Anti-Doping Agency, or WADA. Next, we will study about the forensic issues. For most substances, the mere presence of the substance or an analyte metabolite in the biological fluid sample constitutes an offense. But for some substances, there is a reporting threshold. If the drug is detected, but it is less than the reporting threshold, no offense is reasoned to have occurred. Multifaceted rules apply to some of the substances, not at least, because some have therapeutic uses. The obligation is on the athlete to obtain a therapeutic use exemption for certain categories of substances, with the substances covered under this possible exemption made clear in the WADA list. The WADA list also recognizes that some anabolic agents and hormones are produced endogenously. The fundamental rationale is that an offense is considered to have occurred if one or more of these prohibited substances are detected in an athlete's specimen at a level outside of that which is considered to be the normal range in humans for the substance. For some substances, offences apply both in competition or out of competition, whereas for others, an offence applies only if the substance is detected in competition. For some sports, specific classes of substances are prohibited. For example, beta blockers are prohibited in competition in sports such as shooting, billiards and gymnastics. Alcohol is prohibited in competition for sports such as motorcycling, powerboating and archery. The emphasis when prohibiting the use of a substance is on whether or not the use of a substance or method is proposed to enhance the sports performance. The position regarding the excessive quantities of normal nutrients is much argued for. Although they are not currently included in a prohibited list, there is no hesitation that certain vitamins, notably B1, C and E and also creatine, have been used in large doses with the purpose of affecting performance. Next is the classification of prohibited substances in sports. First, under this we will study about the stimulants. This group of drugs includes psychomotor stimulants, symptomatic amines and other diverse CNS stimulants. They may produce alertness, wakefulness and an increase in the ability to concentrate. In addition, they may improve the competence to exercise strenuously or produce a decreased sensitivity to pain. These effects are potentially of benefit to a wide variety of sports involving sustained physical and mental activity. Next, about the amphetamines. Amphetamines are stimulants that include several structurally related drugs, that is dextroamphetamine, methamphetamine, phenmetrazine and methylphenidate. Physicians prescribe these drugs on a short-term basis for the treatment of obesity and also to treat narcolepsy and minimal brain dysfunction in children. Next stimulant is cocaine. Cocaine, also a central nervous system stimulant, when snorted, affects the brain within few minutes. The peak effect comes within 15 to 20 minutes. When injected, cocaine takes about 15 seconds to affect the brain. The euphoria following cocaine use is in some ways similar to the intense euphoria following an outstanding athletic performance. Both are in part facilitated through the pleasure brain. The individual feels energetic and hyper alert. Next is symptomatic amines. The symptomatic amines are group of stimulants of which ephedrine is an example. However, pseudoephedrine and phenylpropanol which used to be in the banned list of WADA is no more in the same category. The ephedrine is also found in low doses in cough, cold and sinus medications. Because these medicines are broadly used by the people as over-the-counter drugs, they are effortlessly abused by competing athletes for their stimulant effects. Now about the prohibited stimulants are the adrenal, amphetamine, amphetamine, amphiphentamine, amphiphenazole, benzphentamine, benzylpiperazine, bromantane, cathine, clobenzorex, cocaine, cropramide, protetaamide, cyclozidone, dimethylamphetamine, ephedrine, etamivan, ethylamphetamine, ethylphrine, framprofrazone. Then is the phenbutrazate, phencampamine, phencamine, phenytoin, phenphthalamine, phenproprox, furfurox, heptaminol, parahydroxyamphetamine, isomethine, liv-methamphetamine, mecoflunoxate, mecphenoxate, methyltramine. Then is mesocarb, methylene dioxyamphetamine, then methamphetamine, methylephrine, methylphenidate, modafinil, nicotinamide, norepinephrine, norphenfluramine, octamine, ortetamine, phenpromethamine, phentermine, and so on, and other substances with a similar chemical structure or the similar biological effects. Next, we will study about the narcotics analgesics. Narcotics are derivatives of opium and consist of powerful painkiller drugs. Narcotics are not perceived as ergogenic drug. However, their use, misuse and abuse potential in sports may be high because of pressures on the athlete to perform competitively despite varied musculoskeletal injuries. The pressure on the athletes to perform well is so intense that they sometimes turn to narcotics as an emotional escape. These drugs are banned so as to decrease the risk of tragic conditions. The prohibited narcotic analgesics are buprenorphine, dextroaramide, dimorphine or heroin, fentanyl and its derivatives, hydromorphone, methadone, morphine, oxycodone, oxymorphone, pentacozine and pethidine. Next, about the anabolic steroids. The anabolic steroids are synthetic derivatives of the natural male hormone, that is testosterone, which is produced principally by the testes in males and is responsible for androgenic or the masculinizing effect and the anabolic or the tissue binding effects. The abuse of anabolic steroids have historic foundations in man's aspiration to create a bodybuilding wonder drug. This group of drugs is responsible for the most pervasive abuse of drugs in sports. In human sport, the anabolic steroids are used as the bodybuilding agents or drugs, occasionally in very large quantities in events such as weightlifting and shot putting. There are generally two chemical types based upon the androstenedione and the estrone ring systems. Those with a 17 alpha alkyl group, which are active orally but possess hepatotoxicity, and the 19 NOR derivatives administered by injection. Although steroidal estrogens and some stimulants reputedly possess the anabolic activity and are engaged in beef production, they do not appear to be used as the doping agents. Anabolic steroids reverse the negative or the catabolic effects of exercise have on muscle. During exercise, the adrenal glands naturally secrete glucocorticoids that induce muscle breakdown. The anabolic steroids minimize this catabolism and thus build muscles. Next is the exogenous anabolic agents, starting with androstenediol, androstenedione, bolandiol, bolansterone, boldenone, boldione, calusterone, clostebol, danazone, dihydrochlormethyltestosterone. Then next is deoxymethyltestosterone, drostanolone, ethylestrenol, fluoxymestrone, formibolone, furazbol, gastrinone, 4-hydroxytestosterone, mestanolone, mestrolone, metnolone, metandione, methandriol, methastrone. Next is methyldinolone, methyl-1-testosterone. Next is methyl-nortestosterone, methyl-triinolone. Next is methyltestosterone, mybolerone, nandrolone, 19-noradrostenedione, norblutone, norclostebol, norethandrolone, oxabolone, oxandrolone, oxymetrone, oxymetholone, prostanolone, quinbolone, stanozolol, stenbolone, 1-testosterone, tetrahydrostrenone, trenbolone, and other substances with a similar chemical structure or similar biological effect. Next are the endogenous anabolic agents, starting with androstenediol, androstenedione, dihydrotestosterone, prasterone, testosterone, and metabolites and their isomers. Next are the other anabolic agents such as the clenbuterol, the selective androgen receptor modulators or the SARMs, tibolone, zeranol, and zilpaterol. Next we will study about the masking agents and diuretics. Masking agents are the products that have a potential to impair the excretion of prohibited substances, to conceal their presence in urine or the other samples used in the doping control, or to change the hematological parameters, and the diuretics are one of them. The diuretics are the drugs that increase the rate of urine formation. In general, the diuretics act directly on the kidney tubules to yield the desired clinical effects. Clinically, diuretics are used to control hypertension, to reduce edema, and as an adjunct in treating the congestive heart failure. Athletes use diuretics for acute reduction of weight, to meet the weight limits in weight categories, to gain advantage in sports like boxing, judo, or weightlifting, etc. The prohibited diuretics list consists of the acetazolamide, amyrolide, butanamide, canenron, chlortalidone, ectronic acid, furosemide, indapamide, metolazone, spironolactone, thiazides, triametrin, and other substances with a similar chemical structure or similar biological effects. Next is epistrestrone, probenecide, alpha reductase inhibitors. Then is plasma expanders and other substances with a similar biological effect. Next, we will study about the hormones and the related substances. There has been a significant apprehension in recent years over the use of peptide hormones such as the erythropoietin or the EPO and darbepoetin. Athletes recognized the potential for erythropoietin to increase the erythrocyte production and hence the oxygen uptake. Human chorionic gonadotropin or the HCG is a glycoprotein hormone produced in the body, particularly during pregnancy. Administration of the HCG stimulates testosterone production but does not raise the testosterone or the epitestosterone ratio. The peptide hormones act as messengers from one organ to another to stimulate growth, influence sex drive and behavior. The prohibited hormones and their related substances are the corticotropins, the erythropoietin, human chorionic gonadotropin, human growth hormone or the HGH, insulins, insulin-like growth factors or the IGF-1, mechano growth factors or the MGFs, luteinizing hormone or LH, anti-estrogenic substances, aromatase inhibitors, selective estrogen receptor modulators, agents modifying myostatin functions. Then next is the beta blockers. Beta blockers or beta-2 antagonists as well as their dextro and levo isomers are prohibited. Their use entails a therapeutic use exemption. As an exception, formoterol, salbutamol, salmeterol and terbutaline when administered by inhalation to prevent or treat asthma and exercise-induced asthma describes an abbreviated therapeutic common use exemption. A beta antagonist increases the skeletal muscle mass. Lipolysis decreases the deposition and thereby increasing the lean body mass. They also increase non-shivering thermogenesis via the beta receptors in brown adipose tissues. The prohibited beta blockers consist of the acetobutalol, alpranolol, atenolol, beta-xylol, bisoprolol, bunolol, carticolol, carvedilol, celiprolol, esmolol, labetalol, luvobunolol, metipranolol, metoprolol, nadolol, oxprenolol, pindolol, pronolol, sotalol, timolol and the related compounds. Next, moving on to some notable drugs used in sports. Under this, first is Nandrolone. Nandrolone is an anabolic steroid. The anabolic steroids are natural or synthetic versions of testosterone, a hormone that is produced naturally in males and to a lesser extent in females. Anabolic steroids are used in combination with the appropriate diet and moderate exercise to promote a gain of protein in the body and to increase the lean body mass, including the muscular tissue. Nandrolone increases production and urinary excretion of the erythropoietin. It may also have a direct action on bone marrow. Nandrolone binds to the androgen receptor to a greater degree than the testosterone, but due to its inability to act on the muscle in ways unmediated by the receptor, has less overall effect on muscle growth. Next is dihydroepiandrosterone, that is DHEA. DHEA is a steroid hormone secreted in greater quantity by the adrenal glands. It is released when adrenal cortex gets a message from the adrenocorticotropic hormones or the ACTH. The ACTH is released by the pituitary gland of the brain. DHEA is a weak androgen that circulates in two interconvertible forms, unconjugated DHEA and the DHEAs, that is dihydroepiandrosterone sulfate. Athletes use DHEA for several reasons. like as an anti-catabolic agent to increase the levels of androgens such as androestradiol and testosterone. It is challenging to detect because DHEA is a precursor in testosterone formation. It would increase the concentration of both testosterone and epitestosterone. Next is the human growth hormone or the HGH. Human growth hormone is a hormone that is synthesized and secreted by the cells in the pituitary gland located at the base of the brain. The HGH is known to act on many aspects of cellular metabolism and is also essential for the skeletal growth in humans. The reason for HGH abuse appears to be based in deceitful promises that it is as effective as anabolic steroids, with fewer side effects, is less possible to be detected, and may protect the athlete who has abused the anabolic steroid and wishes to stop the muscle meltdown. Commonly, HGH is abused in sports to increase the muscle mass and strength, to increase slender body mass, and to improve the appearance of musculature and to increase the final adult height. Next is erythropoietin. Erythropoietin, or better known as EPO, is a glycoprotein produced by the kidneys that functions to regulate the red blood corpuscles or the RBC's production. This glycoprotein has a half-life of 6 to 8 hours. Approximately 90% of the erythropoietin is synthesized in the renal cortical cells, whereas the rest is synthesized in external sites, mainly liver. Erythropoietin is now potentially available in mass quantities through the process of genetic engineering. Experts speculate that the potential use and abuse of erythropoietin may be vast. Erythropoietin and recombinant erythropoietin, or the REPO, is used precisely by endurance athletes to increase the aerobic endurance with effects similar to that of the blood doping. Erythropoietin is a major factor in the stimulation, proliferation, and the maturation of the bone marrow stem cells, which in turn increases the rate of RBC production. Next are the gonadotropins. The human chorionic gonadotropin, or the HCG, is a glycoprotein hormone produced in the body by placental trophoblast cells, chiefly during pregnancy. Administration of HCG stimulates testosterone production but does not increase the testosterone and epitestosterone ratio. Initially, this made HCG administration challenging to detect, but methods of detection have now been developed for use in human sports of drug testing. Its major physiological role in stimulation of corpus luteum to maintain synthesis and secretion of the human progesterone during pregnancy. Abuse of HCG has become popular because it stimulates the secretion of both testosterone and epitestosterone, resulting in urinary excretion ratios set by the WADA. Next is androstenedione. More recently, scientists involved in doping in sports have noted the use of so-called prohormones. An example is the use of androstenedione, which has been promoted to bodybuilders in dietary supplements and have been claimed to have an anabolic effect. Androstenedione, or the andro, is a hormone produced by the adrenal glands, ovaries and the testes. It is a hormone that is normally converted to testosterone and estradiol in both men and women. Androstenedione is accessible legally only in prescription forms and is a controlled substance. Manufacturers and bodybuilding magazines peddle its ability to allow the athletes to train harder and recuperate more rapidly. However, its use as a performance-enhancing drug is illegal. serum concentrations of estrogen in men can increase with androstenedione administration, giving rise to an increased risk of gynecomastia. Next, we will study about the analytical approach to detect dope drugs. Dope is generally administered at or approximate the therapeutic dose, which results in relatively low concentrations in biological fluids. Consequently, screening procedures must be both sensitive and comprehensive. Generally, these screening procedures depend upon the detection of either the unchanged drug or its metabolites. The identification of the corresponding metabolites is often advantageous supplementary evidence to support the identification of the parent drug. The instrumental methods include gas chromatography using nitrogen phosphorus detection, that is GCNPD, high performance liquid chromatography using ultraviolet detection, that is HPLC UV. Then is next gas chromatography mass spectrometry or GCMS, and liquid chromatography and mass spectrometry, that is the LCMS, are the predominant analytical methods in most human sports drug testing laboratories. Even if not routinely used for screening, some kind of TLC technology is sporadically used by many laboratories to isolate or purify a compound of interest, followed by the analysis of the scrape from the TLC plate by GCMS, LCMS, etc. Now, we will summarize all that we have studied in this module. First, the use of performance enhancing the drugs is banned in sports. However, the physical exercise and exertion impose upon the body an increased demand of nutrients and oxygen. The body can meet the demand only up to a certain level and not beyond which the exhaustion sets in. A sports person needs to keep himself vigorous, energetic, full of vitality and endurance. To achieve all this, some sports persons resort to pills and injection as shortcuts to success. According to International Olympic Committee or the IOC, doping is the administration of or use by a contending athlete of any substance foreign to the body or any physiological substance taken in abnormal quantity or taken by an abnormal route of entry into a body with the sole purpose for increasing in an artificial and unfair manner his performance in competition. The dope test in Olympics began in 1968 but till 1983. Drug testing and detection in international competitions were very ineffective due to non-availability of standard technology. The World Anti-Doping Code International Standard for testing pronounces the procedure for sample collection. The two matrices specified for testing are urine and blood. Urine is the preferred fluid in all species or the body fluid. Its collection is non-invasive, it is generally available in sufficient quantity, and the drugs or their metabolites tend to be present in relatively high concentrations. The disadvantages are that the drug may be present in its metabolites or in a conjugated form, and the parent drug may be present only in a relatively low concentration. The drug concentrations in blood are interpreted more effortlessly than those in urine, and certain drugs that are not excreted in urine in detectable quantities, example the reserpine or human growth hormone, can be detected in blood.